morning and welcome back. Well, it's known as RSV, but you likely know it more as the common cold. Joining us this morning from Gunderson Health System is Dr. Mark Neumann to discuss this. Dr. Neumann, common cold, like I said, is what we know it as, but RSV is the name for the virus. What exactly is this? Is this the same thing we see every year?
So RSV stands for Respiratory Syncytial virus, and it is a common virus that causes cold, and we do see it every year. It comes through about November to March, end of March, and all children by the age of 2 will have acquired this infection at least once in their lives.
Wow, and as often with medical diseases, deficiencies, it can hit children a lot harder. What are some of the things that they might see that maybe older kids or adults might not see?
Well, that's absolutely right, Dustin. In fact, it's the children that are just a couple of months old or younger that are the ones that can have more serious disease. But generally speaking, as we get older, it becomes more and more of an upper respiratory infection in the nose, in the upper airway, the throat. But small children can have problems lower down into the lungs, so that they actually have more difficulty getting a breath, almost like as if they're having an asthma experience.
And complications can arise with this. Pneumonia, I think, is one that can come up for kids if it goes untreated.
Treatment is support, and most children will do well at home. About 2 or 3% might end up in the emergency room and into the hospital, and if it's more serious, then we may end up having to offer more respiratory support. But for those younger children, a lot of attention should be given to good hand hygiene and avoiding exposing the young infants to people who have colds or who might be carrying the infection. Also, we could think about the flu is another thing that you would want to protect your small child from exposure. And that would entail having those local care providers all immunized, so to decrease their likelihood that they would catch the flu and carry it to the infant.
Yeah, but still that flu shot can't prevent somebody from getting RSV or the common cold, correct?
That's absolutely true. These are two diseases, they just run together. And because we were talking about protecting small children, I included that. For RSV, we do not have an immunization, and it's more supportive care and careful hand hygiene, good cough hygiene, making sure children are taught to cough into their sleeves and not straight into the room and so forth.
Yeah, so just plenty of hand washing this holiday season, and if you do come down with it, drink plenty of fluids, get a lot of rest, all that good stuff.
You bet.
All right, thank you, Dr. Neumann, and we'll head to break with a look at what's coming up on Good Morning America.